sorry, the phone isn't. UNESCO is part of the joint UN program on HIV and AIDS, and this is important because the UN family, and so all the UN agencies have come together under the guise of UN reform, and ex-Secretary General Kofi Annan had asked all UN agencies to work on HIV in some way. And so UNESCO is in charge of HIV prevention in educational institutions, and so we focus on education for young people. And basically, every UN agency has its own responsibility. The division of labor has been very clearly defined. So for UNESCO, it's HIV prevention in educational institutions. For UNFPA, it's reproductive and sexual health. For UNICEF, it's HIV for children, pediatric HIV, as well as transmission of HIV from mother to child. I think I'm... Excuse me. Thirdly, UNESCO is responsible for promoting and increasing access to HIV education, school health, and adolescent reproductive and sexual health. And that is basically our mandate all around the world. It's not just Asia and the Pacific. We are partner agencies in many other areas of work, including HIV prevention among men who have sex with men. And so UNESCO is now becoming more and more known for our work with men who have sex with men. And I just want to outline here that men is a very general term in this case. It also encompasses young people, so teenage boys as well. And finally, HIV and AIDS, why we work on it at UNESCO is because it's part of what we call the Millennium Development Goals, and those are universal global goals that countries, member states of the UN have come together and pledged commitment to these goals in the year 2000. And one of the goals in particular relating to HIV is to combat malaria, tuberculosis, and HIV. And lastly, HIV is important for UNESCO because we are trying to achieve the education for all targets. Basically, if children are not in good health, then their learning is compromised, and you need good health to also study, and you need education to sort of promote well-being, so they're kind of interrelated. Next, please. Finally, HIV Education Goals. These are the goals that UNESCO specifically works on. One is to assist in building the capacity of the education sector in Asia Pacific to better respond to HIV and AIDS. And we are working to contribute to a 25% reduction of HIV infection rates among young people globally by 2010. Next, please. And by 2010, we would like to ensure that at least 95% of young people have access to information, education, including peer education, and youth-specific HIV education, and services necessary to develop the life skills required to reduce vulnerability and HIV infection. And finally, to challenge stigma and discrimination towards teachers and children living with HIV and or affected by HIV. So you might be living with HIV, and that's one thing, but if you're affected by HIV, it might mean that somebody in your family, not yourself, is living with HIV or has died of AIDS. And I think here it might be important to just explain briefly what is stigma and discrimination. You know, stigma is sort of the prejudice that people feel, the biases, the negative attitudes people feel towards someone else for reasons, for whatever reason. In this case, of course, living with HIV. And discrimination is the actual action. So the stigma is the thinking, the attitudes, and the discrimination are the actions that people take towards others living with HIV. So those are the things that we are trying to combat. And finally, the last slide, I'd like to invite you to look at our website, because on our website here, www.unescobkk.org/HIV/AIDS, has a lot of different resources here for HIV, and some are in different languages. We're trying to expand the repertoire of HIV teaching and learning materials. So it's not just for teachers, it's also for young people as well. We also provide a service to those looking for specific information and materials on HIV. You may come to that website and request or email their AIDS@unescobkk.org. You may email for further information if you'd like to get help in finding something. We provide that service. So that's the end of the presentation, and I'd be very welcome to any questions at this time.
Yes, thank you very much, Ms. Roseanne, for your straight and clear presentation. And now we will invite the students to ask questions to Ms. Roseanne.
Sorry, because it was you, right? I couldn't talk. I was the big one. Okay.
Okay. We start with the University of Indonesia students in Depok. University students in Depok, hello. So do you have any question?
No, I don't have a question. Thank you.
Depok? No? Hello? Depok?
Hello.
Yeah.
Hello.
Yes?
Hello, good morning.
Yeah.
I have one question to Ms. Roseanne about the rule of the UNESCO to prevent HIV, and I just want to confirm that UNESCO rule is mainly in young people, and how about the adult and maybe baby, because the main infection is through sex, mother to baby, and IDU and MSM, but not specifically young people. Thank you.
Okay.
Okay. Sorry. Actually, in the global, I mentioned in the different types of transmission. One of them was the second most frequent was mother-to-child transmission, but I also mentioned that wasn't for Asia and the Pacific. That isn't actually of great concern. The statistics show that isn't. So for us, the most frequent mode of transmission is still sex between men and women, and that's the first answer to the question about why we're focusing on why we're not focusing on mother-to-child transmission. The other is. Do we only focus on young people? No. We work with teachers and we develop materials for teachers on how they can better, and when I say teachers, I mean school teachers, university professors, and lecturers, on how they can transfer these attitudes, knowledge, and skills to young people. I mean, at the end of the day, our ultimate beneficiary is the young person. We would like to get them the knowledge and information needed to protect themselves. That's the first. And there was another question, but I think, did I answer everything? Is there anything else that I missed?
Yes, thank you.
Okay, thank you. Depok,
Hello,
is there
Berita.
Yeah.
Hello, Berita.
Yes.
We are from Erlangga. Yeah, do you hear?
Okay.
Yeah, we are from Erlangga
Yes.
University. Although we can see the presentation, we are still with you. There are 36% here.
Okay, do you have a question?
Yeah, I have a question. Yeah, I have a question for Roseanne. As I know, there are two information that we have if we want to give health education. The first one is the age of first sexual contact, and then the second one is the description of sexually transmitted disease. As we know that HIV is categorized as sexual transmitted disease. Is there any other data that we have to know so we can assess when we have to start to give health education? Thank you.
Ms. Roseanne, please.
Yes, I don't have the exact name of the publication, but there is something that UNESCO has produced that talks about when to provide sex education, or rather HIV prevention education. And basically I understand that we promote to start sex education at the earliest possible age, and this has shown that, you know, there's a lot of resistance as well in this region for various very understandable reasons for why you know, why ministries as well as teachers are hesitant to teach about sex and HIV prevention at a very young age, for example in elementary school. But the data has shown us that the earlier you start, actually, the result is that there's a delayed beginning to sexual relationships for those children and young people who have had exposure to sex education, HIV preventive education earlier on. So that's my answer to when is it appropriate. And as far as my experience in the region goes, I believe that we leave the door open for countries to determine that. Because, again, UNESCO is a technical agency. We provide the technical advice, but at the end of the day, it is up to the countries, the member states, to decide when is it most appropriate. So we've had different responses. In Central Asia, there's been a very big push to have sex education, HIV education as early as primary school. And in other countries in the region, that has been always lower secondary or high school. So again, it's varying depending on the country context.
Okay, thank you, Ms. Santi. And then the other, Salemba side. Salemba side.
Hello.
Yeah.
Yes, this is Mona. Excuse me, this is Mona from USU, University of Sumatera Utara.
Okay.
Hello.
Yes, please.
Hello. Can you hear me?
Yes,
we can hear you.
Okay. Hi, Mrs. Wong. Thank you for your presentations. I want to ask 3 questions basically. Now, the first question goes to the populations of countries. Is there any influence that highly populated countries will tend to have more AIDS cases? That's the first question. Now, the second question goes to, well, you said that a person who is infected by AIDS doesn't necessarily live in AIDS. Yes, and that is true. However, eventually the infected people will get AIDS. If the infected people will get AIDS, it won't that one day, as AIDS is the last stage basically. And the third question, and this is the uncommon questions. One of them, is there any influence? Will we be affected if we then when we kiss and there is a blood in our mouth, then will we be affected by this AIDS? Thank you.
Okay, Mr. Sanders, that's 3 questions from University of Sumatera Utara.
Okay. I got the first 2 questions, and the third one I didn't get clearly. So let me answer the first 2, and then may you please kindly repeat the third one. It was a bit foggy. The first question is whether population has been linked to high population has been linked to higher cases of HIV. I think that in essence, I don't think that's been proven in terms of, you know, you have a higher number of people living in a country and you have higher rates of infection. But as shown by the cases of China and India, because they have higher numbers of people, the rates of infection may not be higher, but of course the absolute number of people living with HIV would be higher simply because there's more of them. So the answer is the rate of infection has not been proven to be higher in a more populous country, but of course the absolute numbers of people infected would be higher just because there's more people living there, if that makes any sense to you. And secondly, the question was those living with HIV, yes, they don't always get AIDS. And there have been so many cases. This is what we're advocating for as well in the UN system, not just UNESCO, is that people should have free access to what they call antiretroviral therapy, which I think you will hear about by later speakers. These are a group of drugs, yes, that when used in combination can help to control the HIV virus in the body. So basically, it doesn't allow the immune system to get too weak. And basically, if you have that access, you can live for several years. In fact, there are people who've lived in more than 10, 15 years using these antiretroviral drugs and being able to live very productive lives. And so in Thailand also, there is an orphanage here for children living with HIV who are having free access to antiretroviral drugs, and those children normally, and I guess in most cases, they would have died or have gotten HIV, because it's actually, for children who get HIV, it's more, so their immune systems are already a lot weaker earlier on, especially if they're infants, so the chances that they will get progress to AIDS is a little bit higher than adults. But those children have been able to go to school and continue and graduate from, secondary school and move on. So there's been proof of that. Just want to say that around the world, I understand that developing countries, only about 24% of people who need antiretroviral drugs are getting them. And so Thailand is the one exception in the region here in Asia who's providing access at a very low cost, or practically free, to people who are living with HIV. And could you kindly repeat the third question, please?
Thank you for your question. Thank you for the answer. The third questions might sound very uncommon, but this is just out of curiosity. I want to ask whether kissing, when you, for example, there's a case when people are kissing and there is a bleeding over there. Is there any possibility that AIDS will be transformed that way? Thank you.
I think in general, kissing as an activity, because you're not actually exchanging infected blood or anything like that. But let's just imagine if somebody had HIV and you would both have to, like the recipient, the person who doesn't have HIV would technically need to have, coincidentally, a cut in their mouth, open wound or something, whereby the exchange of fluids or infected blood would happen. The chances of that are very slim anyway. You'd have to imagine two people, one with HIV and the other person with an infected wound in their mouth, engaging in kissing. I think that the chances of that are very, very low. In fact, there is a scale, and we have it on our website. You can go into I would invite you to look at it. It is called if you want to note this down, it's called the Building Knowledge About HIV and AIDS electronic course. Okay, that's actually for teachers, but when you go inside there, you will see a matrix, a list rather, of behaviors defined by low risk, medium risk, and high risk. And I think kissing is on the low risk end of it. So that's just an answer for you.
Thank you very much, Mrs. Wong.
Okay, I think the last
Welcome.
question is very important for the young people, I think, yeah? Okay, there's a lot of sites that haven't asked any question. Do you still have question? I will invite one by one. Please, I will invite one. Wait for, I will call one by one because there's a technical problem.
Hello?
Yeah.
Hello? Hello? I am Hasanuddin University. Nice to meet you, Mrs. Wong. Could you tell me, please, how to practice prevention HIV/AIDS of influence to mother and child, and what kind of way about that? Thank you very much.
I'm sorry, I didn't get it clearly. Could you kindly repeat that again? My apologies.
Yeah, it's a transmission from mother and child. Yeah, how about that? Yeah.
Okay, the question is how it happens?
how to practice prevention.
Oh, prevention, sorry.
Prevention
Prevention,
HIV/AIDS for
yes.
mother and child. Yes.
Yes. Well, I guess there's two things. I guess first is, I just wanted to say this, by the way. I didn't actually mention it earlier. But mothers living with HIV, I mentioned there's 3 ways for the mother to pass the HIV virus to the baby, to the infant. But it also has been shown that just because you're living with HIV as a mother doesn't mean that the baby will get HIV. And there's a lot of cases where the baby is born and they are not actually, they're free of HIV. So there's that possibility. It's not necessarily because you're living with HIV and your mother that the baby will definitely 100% get HIV. I believe the transmission rate is roughly, I don't have it here, but I believe it's around, don't quote me, 35%, I believe. So one of the things, of course, is if you are a mother and you believe that you are living with HIV, one way to prevent transmission would be to, of course, take antiretroviral drugs, which is what some women are doing, if they can get access to these drugs. And then they do say that if possible, and this is not very possible in many situations, is to not breastfeed, to provide other forms of milk that are not contaminated with HIV to the infant, if possible. So that might be different types of milk formulas. There's been other cases of other people's breast milk that's not contaminated if you know it's safe. There have been different options for women. Those are the 2 that I can think of, but antiretroviral drugs is really key. That's all.
Okay.
Is that clear enough?
Yeah. Okay, thank you very much. Yeah, I know that there's a lot of sites that have a lot of questions too, but we should move on the next session. But don't worry, because you can write the question to the www.cml.ui.ac.id. Yeah, for the students that you have a lot of questions, you can write it there. Thank you very much, Ms. Roseanne, and then we will move to the next session. So we will have break for 5 minutes to prepare the second session. Thank you.
Break. Oke, bagi side lain akan break selama 5 menit, tapi mohon sekali lagi untuk di mute mic-nya supaya tidak terjadi feedback. Ya, dan satu lagi, mohon nanti kalau ada pertanyaan sesudah presentasi, tunggu moderator memanggil side-nya satu persatu. Jadi kita tidak berebutan untuk menanyakan. Jadi nanti akan dipanggil satu persatu oleh moderator. Terima kasih.
Pak, Bapak. Halo.
Ya.
Pak, kita dari UNER. Ini
Ya.
bisa nggak kalau dalam hari ini dari tadi kita sudah ikut mulai jam 9. Tapi kita nggak bisa lihat, nggak bisa ya hari ini kita bisa lihat untuk yang sesi kedua. Kita bisa dengar, tapi kita nggak bisa lihat presentasinya.
Nggak bisa lihat?
Iya, presentasinya kita nggak bisa lihat, tapi kita bisa dengar apa yang dipresentasikan.
Maaf Bu, sekarang yang tampil di layar Erlangga apa?
Nggak ada.
Kosong ya?
Dari tadi, iya dari tadi kosong.
Iya, halo, maaf, ini saya teknisi MCU-nya. Jadi di MCU itu status di Erlangga itu dari tadi secondary, artinya secondary itu ada video protokol yang nggak sinkron antara MCU sama yang perangkat yang ada di Erlangga. Dari tadi mau saya putus, kemudian coba saya call lagi seperti itu lagi, akhirnya saya biarin karena lebih baik kalau menurut saya bisa dengar suaranya dulu gitu. Mungkin ini sesi istirahat, mungkin saya disconnect dulu, nanti saya sambungkan lagi, saya coba lagi video protokolnya.
Oh gitu ya. Tapi nanti diusahakan bisa lihat ya Pak ya.
Iya, mudah-mudahan bisa, Bu.
Iya, iya. Terima kasih Pak.
Sama-sama, Bu.
Mat, akhirnya gimana status MCU Depok, Mat?
Halo Depok, halo
Good
Pak
morning,
Yoni.
everybody.
Maaf,
Ya.
sebentar
Ya,
Bu. Cuman mau ngasih tahu ini site yang connect ITTC Depok, yang lokalnya itu ITTC Depok, terus kemudian Salemba, terus Undip, terus Airlangga, terus Unhas, terus Unut sama USU. Kalau yang internasionalnya Bangkok, Keio sama Malaysia yang sudah tersambung. Ya, silakan.
Oke, Mat. Terima kasih, Mat.
Iya, Pak.
Untuk site-site yang ada di Indonesia kita sebentar lagi akan mulai lagi. Tapi saya mohon, saya mau cek dulu. Airlangga, apa sudah bisa melihat kita?
Belum Pak, belum bisa lihat, tapi dengar suara.
Oke. Tolong Ibu di-mute juga ya, dimatiin dulu, ya mic-nya. Mic-nya dimatiin. Oke, terima kasih. Mat, itu Airlangga belum bisa lihat tuh. Selamat. Oke, kita akan segera mulai dengan sesi kedua yang akan dibawakan oleh Ibu Moderator. Terima kasih.
Okay, good morning everyone. It's a pleasure for me to have the opportunity to be the moderator of this session. This session, we will have the very good opportunity to meet with Professor Samsul Rizal